What if I told you that you don't have to live with blood sugar spikes anymore? That roller coaster of energy crashes, cravings, and mood swings could end today. I'm sharing a complete blueprint to permanently eradicate blood sugar spikes, something that the mainstream medical system hardly ever talks about. Welcome back to Health Angel Solutions, your one-stop shop for diabetes, thyroid, and hormone imbalance. However, I must warn you that what I'm about to discuss may not align with what your primary care physician and other medical professionals have told you. Regardless, some of this knowledge contradicts accepted understanding, and the most startling aspect is that there is no one-size-fits-all remedy. Blood sugar management is about maximizing your life's energy, focus, and longevity, not just about avoiding spikes or not getting diabetes. The control of weight and the stability of mood. We all know that carbohydrates raise blood sugar, but that's only the beginning of the story. The most recent research from Stanford University's groundbreaking continuous glucose monitoring studies revealed something startling. Two non-diabetic people can eat the same meal and have completely different blood sugar responses. You will notice much exaggerated differences among people with diabetes, of course. It all begins with glucose control. Let's dive into the principles that will change your relationship with food forever. However, after consuming a banana, one participant's blood sugar hardly changed, while another's surged. This is because there are 4 important components that impact your individual blood sugar response. First, the composition of your microbiome. What is your gut microbiome? There are 100 trillion bacteria there that affect how you digest every food bite, but nobody gives that much thought. According to a 2019 study published in the Journal of Cell, gut bacteria have the ability to either speed up or slow down the absorption of carbohydrates, which is influenced by the quality of sleep. Insulin sensitivity can be decreased by 25% after just one night of bad sleep, which is the same as 6 months of high-sugar diets. By the way, this isn't just about how many hours you spend in bed. It's also about your sleep cycles, sleep quality, and stress levels. Here's where it gets interesting. Your circadian rhythm affects insulin sensitivity throughout the day. So eating a bagel at 7 a.m. might affect you differently than eating one at 7 p.m. Cortisol, the main stress hormone, tells your liver to release stored glucose even when you haven't eaten anything. This phantom spike can occur during work deadlines, traffic jams, or even when you're checking social media. I found that stress causes my blood sugar to rise more than eating does. Maria, who in just 6 months corrected her pre-diabetes for me, improving the quality of my sleep resulted in a 20-point overnight drop in my average blood sugar levels. James no longer requires medicine, and here's another. Until I took care of my gut health, I was doing everything correctly but still experiencing spikes. Sophia claims that this is what stopped her afternoon energy dips. This explains why cookie-cutter methods don't work. Although your body is as unique as your fingerprint, don't worry. I'll give you a framework that works for everyone, complete with modification points. Here is a motivation matrix to help you understand why knowledge alone is insufficient. We all possess some level of knowledge. However, since nobody is perfect, let's address the obvious. You surely already know that there are some things you should be doing differently, so why aren't you? Understanding the psychology of long-lasting transformation holds the key to the solution. Willpower has its limitations. We need to work with your brain's reward system, not against it. Because attempting to force yourself to make better decisions out of sheer willpower is like trying to hold your breath underwater. Eventually, you'll come up for air. According to recent brain research, the incentive triad, seeking pleasure, avoiding pain, and conserving energy, is a predictable pattern that drives motivation. The key to combating this tendency, which is ingrained in your brain, is to match your glucose management with these innate desires. For instance, following a stable glucose meal, focus on the immediate rewards rather than what you're giving up. Declare aloud that you feel great and that you have a lot more energy now. This establishes a pleasure link in your brain, which you must repeat after making bad decisions. Keep in mind that most people don't change since the effects of high blood sugar appear so far away, such as kidney failure. I'm good now. Close this gap by monitoring your blood sugar levels following dubious meals. Seeing that spike creates an immediate feedback loop in your brain. Finally, lessen the mental energy needed to make food choices. If your kitchen is filled with only sugary foods, you want to save mental energy by avoiding making decisions. So, go grab whatever you have. You don't want to make that painful decision. However, the most important thing is that your motivation strategy needs to fit your personality type. For example, there are questioners out there, as I can tell from the comments, who need to understand the reasoning behind every recommendation, which is fine, but they also need data research to be convinced, and obligers who require external accountability. Someone will ask for a dietitian or someone to follow them if they expect them to follow through. Now that we have a better understanding of the psychological underpinnings, let's get tactical with the most effective blood sugar stabilizing techniques science has found to date, the spike stoppers, and let's start with the factors that worsen blood sugar. Rebels will not follow instructions but will act to affirm their identity and autonomy. Upholders, on the other hand, are willing to comply with both internal and external expectations, but they require clear guidelines. The glycemic index of white bread increases from 70 to 90 when consumed alone, indicating that sleep deprivation causes carbohydrates to enter your system like a tidal wave. According to a 2020 study, sleeping poorly lowers insulin sensitivity by 30% more than consuming 40 grams of sugar every day. Combination of a high-carb breakfast and sedentary behavior after meals. Sitting after meals increases glucose spikes by up to 40% compared to some light movement and morning cortisol, which peaks within 30 minutes of waking, creates the ideal environment for glucose spikes, and artificial sweeteners, which, despite popular belief, actually make glucose control worse. According to a 2020 study in Cell, they change gut bacteria in ways that lower glucose tolerance, and even mild dehydration raises blood glucose levels and lowers insulin sensitivity. New research also reveals that certain chemicals, such as plastics, pesticides, and Chinese-made household products, can interfere with glucose metabolism. Now for the exciting part. One component that significantly lowers glucose spikes is food sequencing. Just switching up the order in which you eat can lower blood glucose levels by up to 75%. You can practice vinegar preloading by adding 1 tablespoon of vinegar to your water or salad before carbohydrate-containing meals. This will minimize the subsequent glucose surge by 20 to 40%. Always eat vegetables first, followed by protein, fat, carbohydrates, and sugars. Pre-meal exercise, such as walking, bodyweight squats, or sitting exercises, can reduce your post-meal glucose spike by 30% by priming your muscles to absorb glucose. Additionally, certain spices, such as cinnamon, berberine, and fenugreek, have been shown in numerous studies to significantly improve insulin sensitivity. This is because acetic acids have the ability to temporarily inhibit the enzymes that break down carbohydrates. Just half a teaspoon of cinnamon can lower the glycemic impact of a meal by 10 to 30%. Additionally, time-restricted eating, also known as intermittent fasting, which reduces your eating window to 8 to 10 hours per day, will improve your insulin sensitivity even if you don't change what you eat. Recent research indicates that this is partially due to optimizing your circadian rhythm. One interesting method I discussed previously is cold exposure, which activates brown fat, increasing the removal of glucose from the blood. A 2-minute cold shower, or, if that is not possible, a 30-second face dunk in cold water before meals can lower blood sugar levels by 15% after meals. And certain fiber kinds. Not all types of fiber are created equal, such as soluble gel-forming fibers like psyllium husk galactomannan and beta-glucans, which can create a physical barrier that actually slows down the absorption of carbohydrates. However, the most effective intervention of all is glucose variability training, which involves purposefully alternating between periods of higher and lower carbohydrate intake. For example, when you're running around, you know you're exercising, so you can have more carbs, and on the days when you're not very low carb, rather than staying steadily low carb, low carb, low carb, low carb, low carb, you can actually train your body to handle glucose much better. We're not talking about unhealthy carbohydrates here. Rather, we're talking about healthy ones like fruits and vegetables. This is revolutionary because it means you don't have to completely cut out carbohydrates. You just need to time them carefully and train your metabolism to handle them well. Customize your strategy because you are an individual at this time. The crucial aspect that most experts overlook is that your individual glucose depends on factors specific to you. Let me give you an example of 3 individuals who all experienced blood sugar spikes but required entirely different strategies. Despite being physically healthy, 13-year-old Michael, who has a family history of diabetes, had elevated blood sugar. She was on the verge of losing it. Her answer was to modify her diet to fit the periods of her monthly cycle. For instance, she increased her tolerance to carbohydrates during the initial half of the follicular phase and strictly limited them during the luteal phase, when she spikes. Robert, a 58-year-old man, had perfect fasting glucose but experienced dramatic sugar spikes after eating. We tested his gastrointestinal microbiome and discovered dysbiosis from years of antibiotic use. His solution was to rebuild his gut bacteria with specific probiotic fibers or probiotics, and within 3 months, his post-meal glucose spikes decreased by 67% without altering the foods he was eating. This cyclic approach decreased her average glucose by 20 points. He just finished eating. These illustrations show why general advice is ineffective. Genetic variances determine your best course of action. Glucose metabolism is influenced by more than 50 genes. Your hormone levels, particularly those of your thyroid, cortisol, and sex hormones, composition of the microbiota, muscle mass, and distribution, your liver's condition, and the quality of your sleep, your ability to manage stress, exposure to environmental toxins and certain drugs might actually cause blood sugar levels to rise. After I provide you with an implementation design for your 30-day transformation, let's combine everything into a workable system that you can begin using right now. Establishing your baseline and determining your unique triggers will be the focus of week 1. Obtain a continuous glucose monitor. Spend a few weeks testing before and 1 to 2 hours after meals, even if your insurance does not cover it. Keep a record of your sleep, stress, and meal timing. Use those glucose readings to determine the 3 meals or behaviors that cause the most spikes. In week 2, we'll start using the universal stabilizers. Practice food sequencing by adding vinegar before meals that contain carbohydrates at every meal. Add 10 minutes of exercise before or after meals. Make sure you drink 2 to 3 liters of water each day, and in week 3, you'll perform some personal metabolic levers. Based on your data from week 1, identify your largest glucose influencers, if stress is your trigger. In week 4, you will develop some metabolic flexibility, for instance, by using certain stress reduction tactics prior to meals, prioritizing sleep hygiene above all else, and modifying or rescheduling items that cause disproportionate increases. Plan to alternate days with greater and lower carbohydrate intake, match physical activity with higher carbohydrate intake, and use time-restricted eating, such as a 10-hour window to begin and cold exposure training before higher carb meals. The secret to success is to adopt changes gradually rather than all at once. Start with interventions that target your biggest triggers, then work your way up from there. Here's a wider picture for you. It takes more than just the readings on a meter to stabilize your blood sugar. When your blood sugar levels are constant, you have steady energy throughout the day, enhanced mood, decreased inflammation, and increased cognitive function. It's about taking back control of your biochemistry and, consequently, your life. Improved fat metabolism led to better sleep, fewer cravings, and, most importantly, a slowed aging process. This is about making the most of your whole human experience, not just about avoiding illness. When you start with a change today, note how different you feel, and let that feeling, rather than your willpower, pull you ahead. This is the most potent drive, not dread of what might happen if you don't change. The path to stable blood sugar is not about restriction, rather, it is about liberation from the invisible biochemical forces that have been controlling you. The power to permanently stop blood sugar spikes is already within you. Now you have the blueprint to activate it. Remember that your body wants to be in balance. You are not fighting against your nature. Rather, you are removing the obstacles that prevent your body from functioning as intended.